I know there's just a few of us in here today, and that's all right. I know we're all kind of just adjusting back and trying to get ourselves comfortable again with the new year, but we can quickly go around and do introductions, do our icebreaker. So what we can do is we'll kind of go around the squares, or you can tag someone in. I know you're typing your names and organizations, but if you could just say your name, your organization, and then the answer to the icebreaker question, which reads, what is one thing, big or small, that you are looking forward to this year? So the 2025 is over. We're leaving that behind and we're excited to jump into something new. So what is one thing that you're looking forward to this year? And it could be something really small. It could be something really big. Anybody want to share first? Judy in the
Okay.
chat says a new bathroom. Oh, that's nice. Nice. Okay. Anyone else?
Since she put that in that bathroom, I'm thinking about the same thing. My name is Denise Robinson from Community Engagement. We're gonna put that in the chat, right?
You can put it in the chat or you can speak out loud.
Oh,
It's okay.
okay,
Either one
okay.
is fine.
My name is Denise Robinson, Executive Assistant of Community Engagement and Consultation Group Incorporated. And since this young lady put in that bathroom, new bathroom.
Awesome. We have some home remodeling going on. I love it. Sharon says midterm elections. I'm sure many people can agree with you on that one. Yes. Anyone else? I know for me, I will have a 10-year-old this December. She just turned 9, but we're already planning for 10. And she has no idea, but mommy has planned a Disney cruise for her. So it's going to be a surprise Disney cruise.
Ooh,
She's taking
nice.
all my money, but but she's worth it. So I've been paying that off and I'm excited to go, but it will be her surprise 10th birthday gift. So I'm definitely looking forward to that.
Well, I'm up for adoption, okay?
I was laughing because I was telling my parents, I was like, I think I had a skating party. I was like, who goes to like, well, these kids these days, they just have no idea how good they've got it. I think I had 5 friends and we went skating. Anyone else care to share, big or small?
Yeah, sure, I'll go. Sorry, I lost internet connection.
Sure,
Hi,
fine.
I'm Carrie Stansel. I'm with Hospice of the Chesapeake. And I work on the fundraising side. We're the largest nonprofit hospice care provider in Maryland. And one, I guess, big thing is my oldest is about to turn 8. So he'll turn 8 at the end of this month. So
Happy birthday. That's awesome. All right. Any others? Dr. Cooper, do you have anything you're looking forward to this year?
Well, there are many things, but just in reference to this group, I am just excited about what we're going to be doing as far as impactful services and that will be comprehensive in scope and what sort of impact we'll have in a community and being able to measure those outcomes. I know.
I
But
love
it's
that.
a whole myriad of things, but just related to this, it's just a level of excitement.
I love that. Thank you, Dr. Cooper. All right, well, let's go ahead and move on. And feel free if you still want to contribute to the icebreaker, you can do so in the chat. I'm going to turn it over to Dr. Cooper, who will go over our meeting agenda for today, as well as our vision.
Oh, hello, everyone. And as Shanae had said, happy New Year. And I hope everyone enjoyed their holiday season. For today's agenda, what we're going to do is of course, we did the welcome and icebreaker. We're going to review all the agenda items and, of course, revisit our vision and mission. We're going to go over the Community Health Improvement Plan in that overview. And we're going to look at the transition of the work group and how it's going to be woven into the CHIP program. And we're going to go over some community announcements. So that's going to present an opportunity for folks to share. And we're going to talk about our next meeting and then, of course, adjourn. But before we get started with everything else, I'm just going to go through our vision and what do we stand for and what are we about? And as a county in Prince George's County, we're a place where everyone has equitable access to achieve their full health and wellness potential. And that's regardless of their race, their color, religion, country or origin, immigration status, their class, age, disability, sexual orientation, gender, sexual or gender identity, or health literacy skills. And so with that in mind, everything that we do will be integrated into bringing about impactful, meaningful services for all. So with that, I'm going to turn it over to our leader, Shanae. And if you don't mind, you can go ahead and proceed with some interesting topics that we're going to be discussing throughout, not only today, but throughout the meetings throughout the year.
Thank you, Dr. Cooper. As always, wonderful job. So we are going to talk a little bit about the Community Health Improvement Plan. And a few of the slides might look familiar if you attended November's work group meeting, if you were at our December quarterly coalition meeting. But I just wanted to take this opportunity to share an overview of the Community Health Improvement Plan, or the CHIP, as we call it, to make sure that everyone is starting from the same page. We all have this shared understanding of what's going on within the coalition. Again, some slides may look a little familiar at first, but I just wanted to lay this groundwork for this plan for those who may have missed it last year, as well as provide some updates of what we've already done and what's to come, because this is a big moving project. So, as some of you may already know, the Community Health Improvement Plan is really just I call it like the collective roadmap, right? And we're using this roadmap to improve community health outcomes, to advance equity in the county. It's collaborative in nature, it's community driven, and it is also data informed. And this is to help us really align our partners, prioritize what matters most to the county residents, and to coordinate the strategies that we want to use to move us from data to action. Now, our chip development process does follow what's known as the MAP 2.0 framework. And MAP is an acronym for mobilizing for action through planning and partnerships. It's always like this long, these acronyms can get so long. But MAP 2.0, it is a nationally recognized community-wide strategic planning tool. It's a well-known approach for really just trying to improve public health while emphasizing things like strategic thinking, collaboration, and continuous learning. And MAP 2.0 will help us prioritize public health issues while also identifying the available resources that exist and take a coordinated action that reflects what matters most to the community by helping us kind of go through these three phases. And these three phases are building the Community Health Improvement Foundation, telling the community story, and then continuously improving the community. Now, this framework specifically incorporates both quantitative and qualitative data, and it will help us really center community engagement throughout this whole process. So at its core, MAP is really just about bringing together the community's collective wisdom. So again, think about the data, think about the community's lived experience, think about the assets that exist in the county, all the resources that exist in the county. And we're using all of that together to determine how best to create a healthier Prince George's County. So this work, it really, like, I know we're using it for part of our chip, but it really started with our recently published community health assessment, or the CHA. Now, if you're not familiar with the CHA is essentially like a data-driven process that really helped us understand what was going on in Prince George's County. So everything from our community's health status to the conditions that people are living in, what are the strengths that exist in the county, and what other factors exist that influence residents' health every day. And we use this framework, this MAP 2.0 framework, so that our community health improvement plan doesn't just sit on a shelf. We're not doing all this work just to say we did it, right? It's not going to live in some folder somewhere on the computer. This is meant to be a living, actionable plan. So one that's going to take what the data and the community are telling us and then turn it into real strategies and actions that can actually make a difference. So what we want to do is to take what we learned from the CHA. So again, what's happening in our community, what matters most to the residents, and then use the CHIP to decide together how we're going to respond and where we can have the greatest impact. So I like to say, like, in other words, the CHA reveals the community's health story, and the CHIP is the plan to change the next chapter of that story. So we worked to develop this child. We started the CHIP. The CHIP work started in September, and we have the goal of finalizing the CHIP document by July of this year. That is a lofty goal, but I know that with all of our partnerships, with all of us working together and collaboratively, I really think we can achieve that deadline. But we have a little bit of flexibility, so that's the goal. But I think we can do it. So I know we're in this new year, and 2025 may feel like a distant memory to some. It may feel like it was just yesterday to others. But I do want to just kind of briefly remind everyone of what we've done so far during this process. So to date, we have completed phase one, which is building the Community Health Improvement Foundation. So in this phase, we focused on identifying and strengthening our partnerships, aligning some shared visions, and really just establishing the structures that support collaboration. And so last June, I mentioned that our data and assessment team, they published the CHA, and that CHA identified 5 priority health areas. So we have behavioral health, we have maternal infant health, chronic disease, access to care, and social determinants of health. And some of you all might remember that from our November work group meeting. But these findings, we shared them with you all. We shared them with our partners as well as with the broader community last fall. And if anyone hasn't seen the child and would like access to that, feel free to put a note in the chat or send me an email, and I'm happy to forward that along. It's a very lengthy document, but it's some really good stuff in there. Very, very good work from our data and assessment team. But what else we did in phase one is we also established a CHIP steering committee. And in October, that CHIP steering committee, they reviewed the proposed CHIP plan and approach, and they discussed the realignment of coalition work groups, and they voted on problem statements for each priority health area. And that essentially laid the foundation for this coordinated action to improving community health. Now, in the fall, we transitioned into phase two, which focused on telling the community story behind the data. Now, during this phase, you all might remember, we held those facilitated root cause analysis discussions with all of the work groups. And in those work group meetings, we shared some of the key findings and health indicators from the CHA. We reviewed the problem statements that were selected by the steering committee, and then we kind of talked about what some of those root causes were. We used that 5 whys approach, kept asking, well, why do you think? And why did this happen? And why this? So we asked those 5 why questions to really get to the root cause of why we think some of the health issues exist in our county. We got to dig deeper into those root causes. We brought together that data. We leaned in on your professional expertise and the lived experiences of both our partners and the community. And these insights from those conversations were then synthesized and captured into a fishbone diagram, which really just helped kind of visually map the root causes that we identified together. And those fishbone diagrams were shared at the December quarterly meeting. So we talked about those root causes as well as the next steps to outline how this work is going to directly inform our priority setting and our strategy development for the CHIP. So it was only a few months, but we've been doing a lot of work as it pertains to this CHIP, and we've been moving pretty quickly. So that's what's been done. What comes next? So what comes next is phase 3, continuously improving the community. And this is actually like the longest phase of the MAP 2.0 framework, but it's also really where all of the work we've done so far comes together and it turns into action. So this phase in particular is really just focused on developing this plan, implementing the plan. We want to refine some of the strategies that we come up with to address the health challenges that we identified through the CHA and that we talked about in those work group discussions. You may remember during the November and December meetings that I mentioned we would be somewhat transitioning our newly aligned coalition work groups starting in February. So I'll share a bit more about what that transition looks like in a few minutes. But the most important part of this phase is that this is where we begin to draft those action plans. Excuse me. Sorry, I'm a little thirsty today. But these action plans are really just to help us refine the goals and the objectives that we come up with. They're going to help us to really just clearly outline the strategies that we want to pursue for each priority health area. And as those action plans are being developed, we're going to be working closely with all of you. We're going to be gathering feedback. We're going to be seeking your input. We're going to also collaborate with our communications team, with the work group co-chairs, the steering committee, to really just help draft and review and finalize this CHIP document. And once the CHIP is finalized and published, again with the goal of July, that's when we can share it broadly with the community, with our partners, county leadership, and then fully move into implementation. So our goal throughout this process is to ensure that the action plans are, again, grounded in the data from the CHA findings and that it truly reflects the feedback and the lived experience that are shared by our community partners like you, as well as our residents. And what I like to say is, this CHIP document, I'm very much of the mindset this is not a health department document. I know we have health department staff working on this. I myself am a health department staff member, but this is the coalition's document. This is the community's plan. How are we going to work together as a community to improve health in our county? Okay, so that's why it's really important. That's why I'm trying my best to find creative ways to make sure that I'm gathering input from you all as best as I can from all of the work groups, from all of our partners, from all the residents that we have access to have input on this plan. And a part of that is an evaluation component, right? So we can come up with all these great ideas, but we have to make sure that they're actually working. So we'll have an evaluation plan in place, and that's something that we'll all develop together as well to make sure that our CHIP activities are being monitored over time and that we're tracking progress, we're learning from what's working, we're improving what's not working, and then we make adjustments as needed. And what I like to think is like this CHIP is, again, like a living document. So it's not going to stay static. New data comes out every day, priorities shift. Federal government is making changes. The state is making changes. Our counties changing. There's a lot of shifting going on, but this is a document and I can appreciate its flexibility. So this is something that we can continue to revisit and update the plan to make sure that it really does truly remain responsive to the needs of our county residents. Remember, this is a 3-year ongoing cycle. So we'll be looking at improvement, we'll be looking at evaluation and adaptation, and it's all with the goal in mind of creating a lasting, meaningful impact across Prince George's County. Okay? So, how are we going to support this work? So in order to support this CHIP work, we will restructure and rename our coalition work groups to better align with the 5 CHA priorities that I mentioned earlier. And this realignment will also help to directly connect our work groups to CHIP strategies as well as action planning. So a part of this realignment, one of the things we really wanted to prioritize was equity, accessibility, as well as health literacy. And to do that, we wanted to make sure we were using simple, clear, consistent language, plain language that community members can easily understand, something that translates well across languages. You'll notice that the new work group names, are not only consistent in style to really help create more cohesion across the coalition, but it's also to reinforce those positive action-oriented outcomes. So we're going to have healthy starts. We're going to have healthy minds. Our county is going to engage in healthy living. We're going to make healthy connections with our partners and with our community members. And something else that you'll also notice, if you see the arrow across the screen, is that health equity will now be embedded across all the work groups. And that is intentional. Something that I always say is health equity is a foundational thread that connects every health priority area. So to make sure that the health equity principles and equity principles are just fully integrated within each work group, we will be encouraging you all to participate in the other work groups that maybe align with your interests. If you all are experts in some of these other areas, we'll be encouraging you to contribute to those as well. Your subject matter experts and your input as subject matter experts will help us to ensure that we are embedding equity considerations into our strategy planning and our evaluation plans moving forward. So I really think that this approach is going to reflect how central health equity is to our work. So while the names and the structure of our coalition's work group may look a little different, the expertise remains the same, our partnerships remain the same, and the lessons learned from our prior groups, they all carry forward. And I think will just better enhance our coalition as a whole. Okay? So what does this mean for the health equity work group specifically? So what I'd like to say is, like, rather than functioning as a standalone work group, again, health equity is now going to be embedded across every CHIP priority. This means that equity is not going to be just a separate conversation anymore, right? We're going to instead use equity and ensure that equity is used as a core lens for planning, for our decision making, for implementation, and for evaluation across all work groups. So again, we're encouraging you all, our current health equity work group members, to participate in those other work groups that, again, align with your interests, align with your expertise. You can join a work group that maybe you're not familiar with and you want to learn more about, right? This coalition is yours. So you can go anywhere you feel you want to go. But we know that your leadership is valuable, and it's going to help make sure that, again, those health equity considerations are built into our action planning from the start. A lot of times what happens is that work groups come up with these strategic plans, these action plans, these goals, these objectives, these measures, and nobody's really considering the equity piece in it all until it's all finished. And then once equity is considered, now I have to go back to the drawing board and adjust things and make changes when really equity should have been built in from the start. So that's what we hope that this transition will help make sure happens. We want equity considerations built into the action plans from the start. So these newly aligned work groups, we will launch them in February, at which point we will begin developing those CHIP action plans. So our February meetings, our March meetings, it's going to be a lot of CHIP talk, a lot of action planning, a lot of talking about what resources already exist, what partnerships exist, and how we can best come up with a strategy to address some of those key priority health areas. So I just want to talk kind of in detail about what that transition looks like in practice. Okay, so with health equity being embedded across work groups now, the coalition, I believe, will really be able to apply an equity lens in real time. Again, not just at the end of the process. This is going to take place during the planning, during discussions, during evaluation, and those equity considerations will shape decisions as they're being made. Right? So there are 3 key elements that are guiding this transition. So first, you have your choice and alignment. Again, you all will be able to select the work groups that you want to participate in, where you think your skills and your interests best align. The second element is a shared framework. All the work groups, moving forward are going to use a shared equity framework and guiding questions to make sure that to ensure that we're all in alignment with one another, that there's consistency across work groups in how we define equity, as well as how we apply it to our work. And then the third element to consider is built-in action, right? So there's standardized equity components that should be and will be integrated directly into our CHIP action plans. Again, not added later. So this will help us to ensure that equity moves from intention to implementation. The Health Equity Work Group is unique because health equity is our core topic. We talk about equity in everything because that is what the focus of this work group is. Unfortunately, that's not what's happening in some of the other work groups. And I think that that element gets missed sometimes. I think the intention is there, but we don't always know how to implement equity. And so again, that's why I'm looking to you all as the subject matter experts across the other work groups to ensure that we're moving from that intention to intentional implementation. So there are some expected outcomes, and trying to think about what does success look like under this new model, right? And so there are a few key outcomes that I think will guide and strengthen our work as a coalition. So first thing is, we anticipate the consistent application of health equity principles across all CHIP strategies, as well as our coalition work group. This means that every initiative we undertake, every plan we brainstorm, every evaluation measure we come up with, we want to make sure it's addressing the disparities and reaching those who need it the most. The second thing that we're looking for as an outcome is to aim for a clear identification of our priority populations and the barriers that they face. So essentially, by really just trying to better understand exactly who is most impacted, what obstacles exist for them, whether they're social obstacles, economic, is it something that's systemic? We can develop or select interventions for this plan that are targeted as well as effective in addressing some of those gaps and some of those obstacles. And then the third expected outcome is that we want to establish equity-centered goals, strategies, and measures. And this will help to ensure that every objective we come up with, every strategy that we develop, again, every evaluation metric explicitly incorporates the equity lens and tracks real improvements in health outcomes for all community members, especially those who are historically underserved. So together, these outcomes, I think, really going to help make our CHIP more strategic, more inclusive, as well as more impactful. So you all will be able to, again, support the other work groups by serving as those subject matter experts. So you'll be able to ask some of those equity-centered questions when framing some of the problem statements, our goals, our strategies. As subject matter experts, you'll be able to elevate the data and the voices of those with this lived experience, help us to identify some of the potential barriers, some of the gaps, some of the unintended consequences that may arise when we come up with these strategies, and really just help us to select the best equity-focused strategies that we can when it comes to our action planning. So in general, health equity members specifically, you all are leaders in guiding and supporting our equity-focused thinking. But again, equity has to be a shared responsibility. So I think that by modeling our consistent equity practices, the things that we practice in this work group, by modeling that for some of the other work groups, modeling that across work groups, I know that we can demonstrate how to approach community work with an equity lens at every step of the way. Okay. So this was not something that was taken lightly. I did a lot of research. I spoke with experts at the state, at the federal level to get their insight and their input. And they really gave me some awesome resources that I'm happy to share with you all, and gave some great guidance on how exactly can we do that? How exactly can we ensure that health equity is embedded consistently across the work groups? And one of the things that was mentioned in some of the literature that I read, and one of the things that some of the health equity leaders at the state mentioned, was to develop this standard equity guiding questions and to use those during our CHIP action planning. And these questions were essentially organized around 3 stages. So the problem definition, strategy development, as well as implementation and outcomes. So think about some of the presentations that we've had in the past and some of the questions that we've asked in response. Things like who's most impacted, what disparities exist, how are we addressing root causes, not just symptom level things, like how are we really getting to the root of some of these issues. Who benefits the most, who's getting left out, and then how are we ensuring equitable access to the tools and the resources that exist in our county. So we're going to be able to apply some of those things across the work groups. And these questions are meant to be used consistently and to be revisited over time. I think a lot of times what happens is, some organizations might have the equity conversation once and they've checked off the box and that's it. That's the last time they think about or even talk about equity. No, we want this again to be embedded in what we do as a coalition. So these are conversations and questions that we need to be asking throughout the entire CHIP planning process. And so what I'll do is, and this is just a sample of some of the questions. So I'll make sure that our co-chairs, all of you, have a copy of those adapted guiding questions. And then I also was able to put together like a little toolkit to outline and support what consistent, meaningful integration of health equity looks like across work groups. And we can use that to really just guide a stronger and more equitable CHIP action plan. Okay. So a couple of things I know before we transition into questions, I'm sure there may be a few, and then we'll also transition into work group selection, but I do want to just ground us again in a few important reminders, and that's just, health equity isn't a separate priority. It isn't something we should think about in the back end or after the fact. It really is foundational to every single part of the CHIP. I feel like I sound like a broken record when I say that because I've been saying that at all of the meetings, but it's true. Equity should be built into everything that we do as public health professionals, as social service professionals, as community members who just care, right? Equity should be built into everything that we do. And the other thing to think about is, while you all help to lead and model equity-centered planning, it again is really a shared responsibility. Everyone should be considering equity. Everyone in the coalition should be, has the shared responsibility of considering equity across all the work groups. And the earlier and the more consistently that we embed equity into our work, I believe that it will also lead to a stronger and more sustainable outcome for our CHIP action plans, for the strategies that we develop. So I want to encourage us all to try to keep some of these thoughts in the forefronts of our minds as we make this transition. So I know that's a lot because it's like the background and where we are, how did we get here, and where do we go from here? So I do want to open the floor for any comments or questions if anybody has any. And again, you can put them in the chat if you want to speak, you can as well. And I'll try to answer your questions as best as I can. And I'll open the floor now for you. And if none, that's okay too.
I know this is a lot, like you said, to unpack, and it's good information, and it's a good path moving forward. As far as the meeting structures, do you
Yes,
have
ma'am.
dates, times, locations? Well,
Yes.
probably via Zoom for these meetings. And
Yes.
we know the charge pretty much of each particular, work group, but just that information, broken down for each work group. And I
Yep.
guess that will be during the course of the meetings, correct?
Yes, so I actually have a slide that has all of our upcoming work group meetings. So Dr. Cooper, you were on it and always ahead of the game, so I appreciate you for that. So I will make sure we'll get to that slide kind of towards the end, but I'll also make sure to send this presentation out as always, so you all have access to that. And when we get to the next slide, actually, I'll go ahead and jump to that slide. I'm going to ask that you can scan the QR code. I have a link as well I can share in the chat. But two things are happening. This is to help us to update our coalition directory. There have been many partners who have transitioned on to other responsibilities. We also have many new faces with us. And so I want to make sure that our directory is up to date. And then one of the questions that you all can answer that's included in that survey is what work group you would like to be a part of as it pertains to the chip. So I'll make sure you all have access to that. I'm trying to copy the link now, but my computer is being a little funky. So if you could be patient with me on that. But you can scan the QR code in the meantime. Let me see if I can get this for you again, this link.
And as always, you're going to be sending us the slides and the recording of the meeting, so we can always
Yes,
reference
ma'am.
back, because sometimes, again, it's a lot to unpack.
Yes, ma'am.
Meaningful information. And so, going over and processing, sometimes people will have questions afterwards. So
Yes, ma'am.
thank you in advance for taking that into consideration.
Absolutely. And I'm always available by email. So if any questions or comments come to mind, any concerns, I'm open. You can send me an email. If you want to spend 30 minutes, 15 minutes, talk a little bit more in detail, I'm open to that as well. I did drop the survey into the chat for those who need to click the link directly. And again, it's to update our coalition directory, but the very last question is for our health equity work group members specifically, and it's to inquire about which work groups you'd like to serve as subject matter experts. Here. Okay. Any other questions? Yes, Sharon.
So I just wanted to thank you and everybody who has been participating in this group for a long time, because early on, this group, the Health Equity Work Group, has been meeting for a long time. And early on, we did a lot of foundational work. We sponsored two really large convenings related to health equity, and invited heads of agencies, businesses, and of course, community members and nonprofit organizations to participate. So that helped kind of shift some of the thinking in some cases about what health equity was and how it can be implemented. And we also had a role in the Prince George's County Council several years ago in considering health in all policies and passing unanimously health in all policies legislation. And I think that I'm hoping that the coalition, or as a whole, will take on some of this work in terms of keeping equity at the forefront from, both an informational and educational level as well as a policy level. So anyway, thanks, Shanae.
Thank you. And I also heard that the maternal infant health root cause analysis discussion earlier today went very well. So thank you for helping to facilitate that.
Oh, you're welcome. It was very well attended. I was actually both pleased and surprised.
That's awesome. Thank you. Yeah, I can't wait to go back to the recording and to touch base with our staff on that. So thank you so much again. Did I see another hand or maybe I didn't?
It was mine, Christine Stewart's
Oh,
co-chair.
Christine.
Yeah. So I am in an appointment, so I can't talk long. But I did want to say thank you to all work group members, um, and kind of echo some of the sentiment that Sharon said. We've been convened as a work group for several years and have done a lot of several activities that were wide scale and largely probably would not have happened had there not been focused effort on health equity, separate from any topical area. I think, we've discussed some of my concerns about pulling this out, and I definitely agree with the need to integrate health equity into all of the work groups. So I'm so pleased to see the tools that you were able to develop based after following our conversation, and I look forward to seeing how that gets implemented. I still would love to talk more about if there is a need for any sort of wider scale health equity foundational information. I think there's some things that have still been, I think that were still opportunities to impact in the community. Um, that may not fall within squarely within any of the work groups. But yeah, I'm excited about this new phase as well. So it's a both and. So
Yes.
thank you, and thank you so much for your excitement and focus on equity, Janae.
Thank you. Thank you. Yeah, it was also, I'll just say it was a pain point for me, like trying to figure out how can we make this transition but not lose the 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 us behind it and the work behind it. I don't want to negate anything that's been done prior to even me coming. I've heard great things about the work group and all that you all have done, the resources and the tools that you all have put together. So those things will still be accessible to the coalition. And again, we're just looking to you all as the experts in this. So I can't thank you all enough for all the work that you've done prior to my arrival, the work that's been done in the 6 months I've been here, and thanking you all in advance for what's to come, because I know we're gonna make some big moves as a coalition, and I'm excited about that. So thank you so much in advance for that. I think I see a question in the chat for the new members. Can you give guidance on which work group is best for us to take part in? This may also be another continued conversation. Absolutely, Carrie. So if you're inquiring about you specifically or your organization specifically, go ahead and you can send me an email or you can send the coalition an email to the coalition email address. I get both. And then we can set up that meeting. Otherwise, it's really just based on your interests. If there's like, say, for instance, you are interested in some of the behavioral health work that's going on in the county, we'll have our Healthy Minds group. So you're welcome to join that. Or you can tag along and all and see where you fit best and then decide from there. So it's not one or none, if you want to be a part of all, I absolutely welcome it. I absolutely welcome it. Of course. Any other questions or comments? And again, if anything comes to mind later, again, you are welcome to email me directly. You can email the coalition's website and we can set up a time to chat or to exchange emails back and forth as well. All right. Well, hearing none, I do want to share some community announcements. As always, Prince George's County has so much going on. So this is just a snapshot. It's just a snapshot of what's going on in our county. But my first announcement, Hope Connections and the University of Maryland CAP region, they are still hosting the All Cancer Support Group. So that's Wednesdays from 12 to 1. If you or someone you know is interested, you can register to attend. These work groups are great for connecting with others, for getting that additional support that some of our residents need, and really just to gain any additional information or resources to support your journey. So again, All Cancer Support Group every Wednesday at 12 p.m. and that is virtual. Parks and Rec has their winter activities guide available. So I've hyperlinked the PDF version on the slide, and you can also visit their website for more information. Again, I'll make sure you have a copy of these slides within the next day or two, so you can access these links directly, and I'll make sure to include them as an attachment in the follow-up email as well. Prince George's County budget season has officially started. There were 3 sessions. I think one was earlier this week, but these are really just opportunities for Prince George's County residents to share any in-person public comments they have. They can share any written public comments for their fiscal year 27 budget listening sessions. And there are 2 remaining listening sessions. So the next one is upcoming, I think, next week on Wednesday, January 21st. And then the last session is Thursday, January 29th, both from 6 to 8 p.m. And the locations do vary by date. So take note of that. And if you are interested in participating, you can do so. Please save the date. MedStar Southern Maryland Hospital Center and Clinton Baptist Church are partnering for a day filled with educational resources and support for the Prince George's County residents. This will be on March 14th at Clinton Baptist Church from 10 a.m. to 1 p.m. So if you would like to attend, please feel free. Also, they are seeking vendors. So if you are interested in signing up as a vendor, I included a hyperlink to that sign up form on this slide, and I'll make sure you all have access to that. Okay. Registration is also now open for Maryland Wellness's Bridging Hope event, a community conversation on suicide prevention. This event will take place on February 4th. I believe it is virtual via Zoom. Yes, it's via Zoom at 12 p.m. and you can register via the link on the slide. So I hear that's going to be a really good event, so please attend if you're able. Dine, Learn, and Move. You can join Prince George's County Community Partners. Every month they have 90 minutes of free virtual fun where you can get active, where you can learn some tips for making healthier choices. And every month is a different class offering. So for January, they're going to focus on thyroid health, and that's going to take place on January 28th from 6 to 7:30 p.m. The email to register is on the slide, and I've also hyperlinked their entire program schedule for the year. So that's on the slide. You can click that link directly when I send this out, and that's just for your overall awareness. All right. I know we've seen this one a bit. We have a University of Maryland student. Her name is Jenna. She actually came to the December coalition meeting and spoke there a little bit about her research project, but she's still looking for more survey completion. So if you haven't done so yet, or you know some people who might be interested in taking that survey, please do so. She's looking to examine the relationship between personality and health behaviors, and there is a small incentive provided for your participation. So I think you have to be 18 years or older, as well as a Prince George's County resident, to be eligible to complete the survey and receive that incentive. Our Medicare Diabetes Prevention Program. So this is a free program to reduce your risk for type 2 diabetes. So if you or someone you know is at risk, you can call or text the number on the slide to attend their virtual information session. It's going to be held on Mondays from 5:30 to 6 p.m. via Zoom. The link to join is on the slide. And I don't know if Taylor's on the call or Amber,
Yes.
someone. Oh, yeah. Do you want to give a little more information about this program?
Yeah, absolutely. Hi, Shanae. Hi, everyone. I put some kind sentiments in the chat. I just really wanted to echo all of the gratitude that has been expressed for this work group and, continue advocating for you all to be within the coalition and to really offer your expertise, your guidance We truly appreciate it. And, really, really thank you for the time that you volunteered to us all. So I had to give my shout out after spending 2 years with you all and continuing to work with you all. So thank you so much for being champions. Now putting on my health and wellness hat. So for our upcoming diabetes prevention program, so this is going to be a program we are specifically trying to reach folks with Medicare out in the community. So this is going to be a really great opportunity for any seniors 65 and better, as we like to say, who are pre-diabetic, who are, looking to make that lifestyle change. This is a non-medical lifestyle change program. It's going to be free for any folks with Medicare Part B benefits and anyone with a Medicare Advantage plan. We are working with the Advantage plans to understand what the cost may be and to be able to offer it at a free or as low rate as possible for those folks. So if you know anyone, again, in the community, again, trying to engage with seniors, we are prioritizing Prince George's County residents, but really anyone in the state of Maryland can engage in this program as well. So please share it with your networks. Just again, really great opportunity to plug folks into these health and wellness initiatives. And I will continue to keep you all in mind as we continue to expand our portfolio here in the Health and Wellness Division at the Health Department.
Awesome. Thank you, Taylor. If anybody has questions about this program, who would be a great contact from your team?
I will put my contact information here in the chat. So feel free to reach out if you have any questions. Also, if you're thinking of any populations who could benefit from any diabetes education, let me know. We are continuing, to build our team's infrastructure for getting out in the community and providing these education opportunities. So let me know how we can be of service, and I look forward to connecting with you all.
Awesome. Thank you, Taylor. You all are always doing such great work over there. All right.
Thank you very much. Likewise.
Of course. And I think this is my last announcement to share. District 7 Mothers First Initiative, they're hosting a vision brunch. So if you or someone you know is interested in participating in their afternoon of networking, they have some maternal panel discussions going on to provide some support and compassionate care for mothers to be. You are welcome to register at the link provided on the slide. The date for this event will be Saturday, January 17th at 12 p.m. in Mitchellville. Are there any other partner announcements from the group?
Yes, I do have one. And just to, again, expand on the University of Maryland Capital Region, they will be offering chronic disease self-management program classes. It's going to be a 7-week program to help empower and provide resources for those who are diagnosed with chronic disease. And it's in person. The dates would be March 24th through May 12th, and it will be from 10 a.m. to 12:30. And it will be in person at the Lake Arbor Community Center. And it's, the address is 10100 Lake Arbor Way in Bowie, Maryland. And registration is required, so I will send that information to you. I just received it today.
Awesome. Thank you so much. Yes, if you can send that to me, I'll make sure it goes out with the presentation and announcements as a follow-up.
Thank you so much.
Of course. I'm just taking notes so I don't forget. All right. Any other announcements?
I have one. So I just wanted to let folks know, in case you are not on my long mailing list, is that the Regional Primary Care Coalition is going to be closing the organization and dissolving. It's in process now, and most of our work is going to be over by the end of January. But I just wanted to let you know that our website will be operative until November of this year, and I will be answering our PCC emails definitely through the end of January. And so I have enjoyed and really felt like the time that RPCC has been engaged with the Health Action Coalition, it's been really valuable. It's been really valuable to make connections with people. It's been really valuable to increase understanding of what's going on in the county and with county residents and what they're experiencing related to healthcare. And I have been encouraging throughout my time with the coalition, I've been encouraging other people to join and participate because I think it's that valuable. And in terms of me personally, I will be transitioning to being a consultant. So I will be sure to send out my contact information as soon as it's set up, and I'll send it to Shanae, but I'll also ask her to send it to you all for future use if you need somebody with who's a generalist with some skills in convening, facilitation, research, and such. Have to make my personal pitch here.
Absolutely. Thank you, Sharon. That's awesome. Yes, please make sure I get that contact information so I can share that out. Thank you for all that you've done with RPCC and all that you've done with the coalition as well.
Yes, and I will most likely, I can't make a promise quite yet, but I will most likely be continuing just in a slightly different role.
Great. Awesome.
And Sharon, just so that you know, it looks like Christine has mentioned, of course, thank you for all your work that you've done in advance for health residents in the National Capital Region. It's been a pleasure working with you over the years, and that's from Christine Stewart. And again, I echo everything that she says, and Shanae, and I think I can speak for the rest of the group. You have been such a wonderful resource, a champion, an advocate in bringing about impactful services, communication, dialogue, and awareness in the community. And thank you so much. And if we can tap just the portion of your time, I know, again, that dynamic will change, that we will greatly appreciate it. And we look forward to working with you in some capacity. And please keep in touch.
Yes, and I am always available to answer questions or to, provide information whenever I can, and that's free.
Awesome. Thank you so much. Let me see a couple other comments. Oh, yeah. Actually, let me put my email in the chat now for you.
Okay, Ms. Vic, can I make that announcement?
Absolutely.
Yeah, CECG on Saturday from 12 to 2:30. We're having a career pathways exploration, and we have some speakers from the Army, employment opportunities, business AI and machine learning, entry-level tech jobs, data visualization and analysis, marketing, careers, and vocational training, and blue-collar jobs. It is on Zoom. If, like I said, if you send me your email, I can send the flyer. You can send it out to everybody else. We're still taking names for that event that's coming up here on Saturday.
Awesome. Great. Thank you. And I put my direct email as well as the coalition email in the chat for you, Denise, and for anyone else who has any follow-up or questions about the coalition transitions or some of the other work groups. I did put that contact in the chat. And then another comment from Taylor, Sharon, thank you, thank you, thank you. Words can't express our gratitude. Please take some time to reset. Yes, please do that. Wishing you all the best in this next chapter. All right. So as I mentioned with Dr. Cooper a little bit earlier, on this slide, you'll see our upcoming work group meetings for your awareness. Just a quick snapshot. It's just for the quarter. But again, we look forward to your participation and your shared expertise at these meetings. And once I see those surveys and see which work groups you selected, I'll be able to directly send information to you regarding each work group. But as a special thank you, before we go, I have to extend my heartfelt gratitude for our amazing co-chairs, Ms. Christine Stewart and Dr. Sharon Gibbs Cooper. You all have provided us with such insightful, thoughtful, and inspiring leadership. I know I've only been with the coalition for a few months so far, but the impact you all have had on me personally and professionally, I know I've shared a little bit with you at our co-chair meeting, but you all have been most influential. We've learned so much from you all as health equity leaders and experts, and I am just most hopeful and excited to see your continued leadership in across the other work groups. So thank you, ladies, for all that you have done. And as always, thank you to each one of you. I know our time together again has been short, but our in-depth discussions, our partner presentations, your expertise have all helped to really guide a lot of the efforts moving forward with the coalition, with the CHIP, and within this community. So again, I truly look forward to all of your shared expertise across the other work groups. And I'm truly just excited for the lasting impact that I know we are going to make in this community. So thank you again, everyone. I appreciate you all and your time. And I'll put the QR code back up for anybody who just needs to see that again. But thank you all so much and have a blessed day and a happy new year.
Okay, same to you.
Thank you, everyone. Have a great day.
Have a great day.
Thank you.
Thank you.